about the muscle itself, contractile muscles. Afterload. Afterload is the force that ventricles must overcome to eject blood. This is again a force which is also pressure. So here, the afterload will be explained by the pressure in the systemic circulation. So when you see this, the systemic circulation, if there's edema, the weakness, there's a problem, there's a tumor, there's a disease process. So the blood coming to the right atrium may be very slow or few, then there is a problem of the stroke volume. Because the lesser the volume of blood coming to the right atrium, of course, there's effect, consequent effect. On the left ventricle to pump blood, the volume will be different. Okay? So it's determined by the blood pressure in the arteries and pulmonary circuit. So this is very important. Increase in afterload causes decrease in stroke volume, and increase in EV. That's why people with pulmonary disease, emphysema, COPD, this is a very bad disease. So your stroke volume will be affected a lot because of the effect of the afterload. Okay, so summary of these. So we have here, we are aiming for the very good stroke volume, right? So how to increase the stroke volume? So what, for example, the preload, on the preload factor, you have to increase your EDV to increase the stroke volume. Your contractility should increase. It decreases the ESV so that you have good stroke volume. The afterload, you have to have a steady ESV, right amount, so that on the left heart, you can have a very good stroke volume effect. Okay, so factors that decrease the stroke volume. So if the preload is decreased, contractility is decreased, but the afterload is increased, so your EDV here will decrease, your ESV will increase, and then you have this high amount of ESV, so your stroke volume decrease, which is not good. So it means there's not enough blood going to your systemic circulation, and there's not enough blood going to your lungs. Okay? Yeah. Okay, so factors that affect the heart rate, chronotropic agents that affect the heart, and then the inotropic. So chronotropic are the agents that increase the heart rate. So, for example, epinephrine, right? Epifen, what is an EMP here? It's always found in the emergency box. Okay? Examples are the sympathetic nervous system and hormones that elevate the temperature. Again, we have the chronotropic agents. These are the negative ones that will decrease the heart rate. Example, acetylcholine. So that's the parasympathetic portion of the blood. Okay? So, heart innervation. So again, I told you about autonomic nervous system. So it's divided in sympathetic and parasympathetic. If you look at the entire nervous system, so the central nervous system is composed of brain and spinal cord. So that is one division, and another division is the peripheral nervous system. The peripheral nervous system has two divisions. One is sensory, one is motor, as I told you. We do not care about the sensory because these are voluntary, but we care about the motor division, and the motor division is divided again into visceral and somatic. Somatic is voluntary again, because heartbeat is not voluntary, so we are here on this visceral motor division. But the motor division is again divided into sympathetic and parasympathetic. Here, take note here, sympathetic division increase heart rate, parasympathetic division decrease heart rate. Add it into your notes. Okay, so going to the drawing, so this is your sympathetic division, and this is your parasympathetic. Sympathetic is composed of thoracolumbar nerves, peripheral nerves. And then your parasympathetic is composed of cranial nerves and sacral nerves. So this increase heart rate, sympathetic. This decrease heart rate, parasympathetic. Okay? Okay, so sympathetic, we already know that. Norepinephrine is chronotropic, increases the heart rate. Yes, that's the flow of the sympathetic ganglia going to the heart, and then try to pump the myocytes. Okay, and sympathetic nerves increase heart rate because it stimulates SI node and AV node. So those are the sympathetic nerves that control the calcium release, so that it will increase your stroke volume. Okay, so that's what it is here. So negative chronotropic decrease the heart. That's the acetylcholine. So other chemical agents, epinephrine, thyroid hormone, glucagon, aldosterone, antidiuretic factor, antinatriuretic factor, affect the heart rate, either to decrease or the increase. So the epinephrine and norepinephrine increases. These are chronotropic. The thyroid hormone increases heart rate. Thyroid and glucagon, this is thyroid and glucagon in the pancreas. These are inotropic. Yeah. Okay. And then you have aldosterone and adrenal gland. You know the adrenal gland, right?
Yeah.
It's sitting above the kidneys. Yeah. And antidiuretic hormone coming from the posterior pituitary or hypothalamus, it will increase blood volume and preload. Okay. So that is chronotropic. It increases heart rate, and then as a result, it's the increased cardiac output. This is found coming from the right atrium, AMP. We call this decreases blood volume because this is in response to high blood pressure. So this goes to the kidney tubule, kidneys shrink, kidney tubule shrink. So there is water retention. The homeostasis come back. So it will result in reduced cardiac output. Okay. Other factors that will influence cardiac output. Now we're talking about cardiac output, not anymore the stroke volume, the volume per minute, per beat. Here we're talking about the volume per minute, okay? Electrolyte concentration in your blood, body temperature, okay? Aging, yeah, and then physical fitness, okay? So this one, electrolytes in the fluid, either it's in ECF or in the blood, will affect the length and magnitude of action potential because we need calcium. Remember, these are electrolytes. We need calcium, we need sodium, we need potassium, right? And then in here, the SI node fires more rapidly at higher temperature. So high temperature, you have very, very high volume, and then slope in lower body temperature. In young children and elderly, there is very high resting heart rate, and trained athletes have much lower resting heart rate. So, and if you look again to the factors that will increase or decrease the cardiac output here, and increase cardiac output, decrease cardiac output. So this is the flow. So hormones decrease fluid retention in the kidney. So you have a preload, less stroke volume, less cardiac output. So this stroke volume and cardiac output is directly proportional. If there's less stroke volume, of course, there's less cardiac output, right? And then here, the parasympathetic in the decrease, body temperature decrease, so decrease cardiac output. While when in the situation there is increased cardiac output, so your stroke volume should increase and your heart rate also increase, and it affects the preload and the contractility and the afterload. And here, your body temperature, okay, increase the heart rate, your parasympathetic and nervous innervation and hormones that can cause fluid retention of the kidney will increase cardiac output. So just get the flow, and then You know the meaning of preload, you know the meaning of parasympathetic, sympathetic, you know the afterload, and then you know the contractility factors. So then you will understand everything. Okay, let's go now to the diseases. So coronary artery disease. Where do you find the coronary again?
The heart.
In the heart. So those are the arteries found in the heart. So a block, because there are fats. There will be a block. So it will deprive your muscle cells, your cardiac muscle cells of oxygen. So that will be a coronary artery disease. So fat plaques of coronary. So it's very much, I believe, number one cause of death in the world, not only USA. Yeah. So CAD decreases blood flow to the heart muscle will lead to myocardial ischemia. So ischemia is death of a local muscle tissue. Not necessarily the whole of your heart muscle, but maybe part of that. So when part of your muscle cell in the heart will die, so that the pumping mechanism, your contractility, right, your preload will be diminished. Okay, so angina pectoris is a term when there is pain in the chest. That's a sign of impending CAD, coronary heart disease. So we call this MI, or heart attack, myocardial infarction. Infarction is death of the cells, like ischemia. Okay? So that occurs when plaques in the coronary rupture and form clots and obstruct the heart from getting some oxygen from the blood. So that's how it dies. So these are the symptoms: neck and arm pain, shortness of breath, sweating, anxiety, nausea, or vomiting. So this is important. If someone in your household will have this kind of symptom and will be obese and eating a lot of salt and taking high blood pressure pill or with high blood pressure, so expect you got to go directly to the hospital. So mainly women may not suffer chest pain, but they suffer back pain, jaw, or arm pain. So women and men have different symptoms. They don't know why. Okay? So risk factors of CED and MI: smoking, high blood pressure, poorly, or controlled diabetes, high levels of certain blood lipids, obesity. When you age, male of 40, female of 50, genetics and male gender. More on men. Yeah. You see, so many people have these bypass, coronary bypass. Clinton, even those very, very popular or celebrity or presidents, they suffer like us. So they go to the hospital, they suffer pain, they have heart transplant and coronary bypass. Ooh. So we are all human beings. So in case of this, we all suffer, right? Okay, so treatment, of course, modification, lifestyle modification here is the first line of defense. First line of medication, angioplasty. Have you heard about this? Stent. Put stent on the blocked artery. Insert tube and then widen the artery lumen. So the coronary artery bypass, yes, grafting. That's a second. And if it's not, if the stent is not good, coronary heart bypass, then heart transplant. Okay? So after that we have this arrhythmia, disturbance of electrical, so fibrillation. So what is the definition? Different parts of heart depolarize and contract while it polarites. There's no pattern. So has no discernible pattern of P waves or no P waves at all. So ventricular fibrillation on the ventricles has chaotic activity, and it's really very life-threatening. Why? Because the blood is going crazy, then it can form blood clots inside the blood vessels. Yeah. So heart rate less than 60 beats is bradycardia. okay, and heart rate more than 100 beats per minute is tachycardia. Okay? Block disruption of normal conduction pathway of the heart. So murmurs are defective valves. Okay? Anywhere of that, and as long as there is in the valve, it's the turbulence of the blood flow. That's murmur. Okay? If your doctor says, "Oh, you have murmur," but it can be heard. So you suspect there is some sort of problem on the valves. Okay? Either AV valves or cellular valves. Either of the four. Okay? Hypertrophy. Oh my God, this is already dangerous. So when your ventricles hypertrophy, it is to say your heart is overloaded with activity. It's having a hard time pumping blood. So it's compensating. So that's why it becomes bigger and bigger and bigger, larger and larger. So instead of a normal like this heart, it becomes large, hypertrophy. So in the end, your muscle cannot anymore contract properly. Cortisol need to generate more tension and pump against the higher outer lobe. So that's very bad. So hypertrophy may result from respiratory disease or high blood pressure, or if it is untreated, heart failure. Okay? And the general heart failure thing is, we call it congestive heart failure or CHF. So in this condition reduces the heart ability to function effectively as a pump. So there will be backflow pulmonary edema or systemic edema. So then you need, I think, in this case, you need pacemaker if you cannot do that. So heart failure may be due to many causes, like we studied ischemia, right? Next to ischemia is infarction, valve disease, these murmurs, valvular disease, cardiomyopathy, your muscles, cardiac muscles are hypertrophied, and electrolyte imbalance. So, of course, lifestyle modification is okay, medication, and possibly heart transplant or other surgeries. So heart failure, lifestyle modification, weight loss is important, exercise daily, sodium intake very low, drug therapy, and so on and so forth. Okay. So surgery, yes, may be done, or to implant a pacemaker in the SA node. Okay, yeah. Got it? Oh, so many absent. Here, I will check your attendance. Yeah? Okay, so let's go on to the next.